Upwards of nearly 25% of Americans have experienced GERD in the last month. That's one of the statistics. So it's something that's definitely very prevalent. And I think when we're talking about understanding, I think there's going to be some variability in individuals' understanding of that.
Myth number 1, GERD is prolonged heartburn. One of the most common symptoms of GERD is heartburn, but it's typically not a prolonged heartburn for most patients. It usually happens more so what we call postprandially or after a meal, or can happen at bedtime.
Myth number 2, you can take over-the-counter medications unmonitored. Well, this is actually a true statement. They probably shouldn't do that for a very extended period of time. Most of the packaging for anti-reflux medications will say do not take longer than 2 weeks.
Myth number 3, medication is the only treatment option. This is false. We have other treatment options for GERD. The simpler type of treatment options for patients are things like diet and lifestyle management. For patients that identify certain triggers such as spicy foods or acidic type of foods, trying to limit intake of those foods. They also have some anti-reflux surgery options.
Myth number 4, if you have surgery, you will never eat normally again. Well, hopefully this is a myth. So the goal is that the esophagus continues to function normally, but there's a barrier to prevent stomach contents from splashing back up into the esophagus. Now, before somebody undergoes anti-reflux surgery, they should be undergoing appropriate testing to ensure that their esophagus is working normally to begin with.
Myth number 5, acid reflux and GERD are the same thing. Well, this one really isn't entirely false. GERD is gastroesophageal reflux disease, so most commonly would be gastric acid coming up. Sometimes you can get reflux of other gastric contents as well coming up, partially digested food products or even bile acid or more alkaline type of reflux that can happen. So